My name is Dr. Trudy Ufondu, and thank you and welcome to this afternoon's Open Clinic. Every Sunday by 5 p.m. Nigerian time, we normally host a clinic called Maternal and Child Health Open Clinic, Weekend Clinic. Now, today's clinic is very important because we are going to go back to the very first important topic. When we started our journey in women's health, we started with ovulation. So today we're going to talk about ovulation and how you can track ovulation and know about your reproductive system and increase your opportunity and your chance of getting pregnant. So today's clinic, it's very important. So if you don't know well about your ovulation or you previously learned one or few things about ovulation, it's important you pay attention. Today's clinic is going to predominantly concentrate on the concept of ovulation, methods of tracking your ovulation, what you need to do to improve your chance of becoming pregnant. So when you come in, please announce your location. Tell me who you are. So I want to know your name. Your name is very important. Your location is very important. This broadcast, it's on 3 different platforms. We are in YouTube. So if you're in YouTube, please check our channel, Snowspirations Health. If you're in Facebook, please check our channel in Facebook. We are in the page and we are also in the group. Now, if you are my personal friend in Facebook, you can also participate. So we have actually 4 different platforms: our Facebook, the page, the group, and my personal timeline, then YouTube. Now, YouTube is very important to join our community because there are so many important, helpful videos in YouTube. So many on all the topics in women's health. So if you haven't joined our YouTube, you are missing a lot. So follow the admin, click on the link, and join. Now, to make sure you don't miss the important videos in YouTube, go and subscribe. When you are done subscribing, please click on the button or the bell on top. It's a notification that will tell you when I come live. Now, previously, I upload 2 videos every week, but based on demand, we upload every day. So if you keep a track on our pages, our group, and YouTube, you will definitely have 1 video every day. These are life-changing videos that can help you to know better. Now, today, I'm particularly happy because my very good friend is back. So if you remember, I had a teaching model, but I have to send it to my co-provider in Nigeria, Dr. Ndichie. But I recently got a new teaching model. So this is very, very important. Everything we're going to be discussing in Snowspirations is going to be based on this. So this is the female reproductive system. This is the complete set of how the female reproductive system looks. Okay? So this is exactly the female reproductive system. This is everything about the concept of becoming pregnant. This is the womb, very strong organ, the strongest organ in the body. This is the entrance from the vagina. Okay? Now, this is the ovary. You have 2 ovaries. Okay? Then this is the tube. You have 2 tubes. So you have 1 tube, the other tube, the ovaries. Okay? Now, when you open up, so this is the cross-section of the female reproductive system. So every woman in attendance today should be conversant with this. Subsequently, I'll be teaching with this. Today's event, I'm going to use this to teach. So everything about ovulation I'm going to talk about today, I'm going to use this to teach. So let me repeat again. So this is the lumen of the vagina. Okay? This is the junction. Hold on. This is the cervix, right? Now, when you go in, Sorry. So this is your womb, okay? Then you begin to navigate. You get to the tubes, okay? Now you get to the ovaries, okay? So this is very, very important. If you don't know about this, please be conversant with this because this is life-changing. So I'm so excited I got my teaching model back. I will be using this to teach subsequently. Okay. So but today we're talking about ovulation proper. Different methods of knowing about your ovulation. So at the center of becoming pregnant is ovulation. Without ovulation, you cannot become pregnant. Without ovulation, you can't be a mother. So every singular woman should pay attention to this topic. It's very, very important. Okay, so when you come in, make sure you announce your location. Make sure you're hearing me properly. If you can all hear me, just give me a high five. So I will make sure we are following. So your location is very important. Then it's also important you're hearing me clearly. We are in YouTube. We are in Facebook page. We are in Facebook group. Then if you follow me on my timeline, you are also going to benefit. So in next few minutes, I'm just giving opportunity for everybody to attend. This is the most important topic in women's health, ovulation. If you don't know anything about your body, you must know about your ovulation. This is very, very important. So that's why I'm trying to give enough time so that everybody can participate. So please tell me your location. Focus on my admin. So focus on Chi Evelyn, focus on Onyinyechi Okafor, focus on Ebenezer, then Dr. Ndiche will also join to provide backups. I normally love counting down to 50, so I can give everybody an opportunity. Now, remember that on the 25th of this month, we have a very big event, Assisted Reproductive Technique Symposium. If you are planning to go for IUI, intrauterine insemination, or also called artificial insemination, you must attend. If you are contemplating IVF, in vitro fertilization, you must attend. If they told you need surrogacy, that means for some reason you can't carry your baby, you must attend. If you are planning to go for donor egg, which is highly recommended, donor sperm, which is highly recommended. If you are thinking of going for fertility treatment, please attend. Now, my people, let's understand this. If we don't have infertility, then I won't be showing up. Then we have infertility. We have a problem. Now, in life, when we have problems, what do? We go to the best. Now, it won't pay us if we identify that you're having infertility problems, then we are not following up with solutions. So our group is not just to identify problems, we also proffer solutions. Now, unfortunately, my sister, if you are not able to achieve pregnancy by yourself, which God designed, you're 35 years and above, you've done this for 6 months, you are not able to achieve pregnancy, you need to step up. You will need help. When you get to a fertility specialist will assess you and come out with a diagnosis. When the diagnosis is made, we are now going to formulate different treatment modalities. So some people can be given Clomid, letrozole, whatever you have, injections. That might be your difference. Some people might need IUI. Some people might need IVF. Some people might need donor eggs, donor sperm. So whatever you need, please, the earlier you accept and the earlier you begin to work towards getting results, the better. I'm emphasizing this because for some reasons, it's poorly registered. If you want to be a mother in 2022, which is blessed assurance, start sowing your seeds. Start doing something. Start taking action. Don't just show up and be praying and you're not playing and you're not practicing. Today is Sunday, you've gone to church, you prayed to God. That's your own part. You need to go back and make love to your partner for 8 hours. Then you need to practice. Practice means attending events, seeing a fertility specialist, increasing your chances of becoming. So let me start my presentation. So today we're talking about ovulation, okay? So I'm going to share my screen and I want you to pay attention so we can get things started, okay? So I'm going to use my teaching model to show you guys a couple of things you need to be conversant with, okay? All right, so here we go. Okay, so today, let me keep this for a little while. So today we're talking about ovulation simplified. tracking ovulation and achieving pregnancy. Like I mentioned, if you know your cycle, assuming your cycle is 28 days, at the middle of the cycle, which is approximately 14 days, some hormones will go to the ovaries and start getting it ready. That particular hormone is called follicular stimulating hormone. It will stimulate the follicles. The follicles are the vehicles that contain the eggs. So as the follicles are growing, that particular follicle is called dominant follicle. It contains the egg. Now, about day 14, there will be a surge in another hormone called LH, luteinizing hormone. That surge will happen about 24 to 36 hours. Once it happens, it's going to give signal to the body that ovulation is about to happen. Ovulation is simply the release of your eggs. Once you release your eggs, and God on our side, if your partner has good sperm, you're going to get pregnant. So what we're going to try to do today is to discuss the various methods of tracking. So tracking is a method of natural family planning or fertility awareness method. If you know when you ovulate, you can have sex about 2 days before and on the day of ovulation. Now, this is contingent on your age and the ability to still be ovulating, to still be bleeding. If you have an ovulatory cycle, that means every month you are releasing an egg, then you can apply this. And this can work better for women below 35. So if you are younger than 35, when you are trying to conceive, it helps to track ovulation to make sure that you're targeting your fertility window. Fertility window is when you have the best potentials of becoming pregnant. So some couples can also use the ovulation tracking to avoid pregnancy. So it's called different stroke for different folks. So some people want to become pregnant and some people want to avoid pregnancy. So if you can target when you are ovulating and you don't want to become pregnant, you can also avoid pregnancy. Ovulation tracking is a method of family planning and fertility awareness. Whether you're just trying to attempt to conceive, or you've been trying for a while without success, or you recently had miscarriage, tracking your ovulation can help you to increase the odds. It's also good to be aware of the symptoms of ovulation. So ovulation can affect women differently. Symptoms of ovulation can present differently in women. Some women will notice breast tenderness. That means when your partner is touching your breast, you're feeling pain. Some women will feel bloating. Some women will feel spotting. Some women will cramp. Some women will have what we call mid-cycle pain. Some women will have increase in libido, increase in taste, easy irritability. These are all signs you are likely ovulating. Now, some women will also notice increase in their cervical egg white mucus consistency. Okay, so what are different methods for tracking your ovulation? Number one is the popular calendar method. So for this to work, you have to have a regular predictive cycle. So this can work better for women below 35 who are still ovulating, who are still having their bleeding. So if you have irregular bleeding, this calendar method might not work for you. So if your cycle tends to be the same for same day from month to month, it's good to bet that you can ovulate around 2 weeks or 14 days before your expected period. So when you bleed, after 14 days, it's expected you release an egg. That process of releasing egg is what ovulation is all about. Now, of course, this can vary on individual cycle. So some women can have 35-day cycle, some can have 21-day cycle, but the regular cycle is 21 to 35. So long as you're bleeding every 21 days and you're bleeding every 35 days, that's the normal range. So you have to be conversant. So it's not all women that will bleed for 28 days. This method, it's less helpful if you have irregular period. It will not work if you have irregular period. If you are younger than 35 and you have regular period, you can pinpoint when you ovulate. Now, if you want to get pregnant, when you pinpoint your 14th day, which is the day you ovulate, and you add the extra 5 days, which is the opening of the window of your fertility time, The reason why we have 5 days before ovulation is because the sperm can survive up to 5 days when deposited inside the vagina. So your fertility window is 5 days before your ovulation and a day after. So that 7 days period is when you have the best chance of becoming pregnant. But it's contingent on the fact that you are having a regular cycle. The second method is what we call charting your basal body temperature. So your basal body temperature involves you taking your temperature first thing in the morning before you even come out from the bed. By maintaining a chart over the duration of your cycle, you can easily dictate when you have a spike. When you are ovulating, the body basal temperature will go up. So you will notice a spike. This might be difficult for people that are not disciplined. So charting your basal body temperature is also a good example of knowing when you ovulate. Now, popularly out there, the commonest method of checking ovulation is what we call ovulation predicting kits. Now, ovulation predicting kit is actually a urine test, just like your pregnancy test. And what we are interested in, it's in the level of rise of the LH hormone. So in the cycle, when the follicular stimulating hormone is preparing the eggs, once the egg is ready to go, there will be a spike within 12 to 36 hours in the LH surge. It's called luteinizing hormone. So it's more like the forerunner. It will announce to the body, hey guys, the egg is about to come. So ovulation predicting kit is actually checking the level of LH. There's a particular color pattern. When you pee on the test strip, it will tell you that you have an LH surge. Once the test predicts ovulation, it's recommended you begin to have sex daily for the next several days. Now, in most cases, it will take more than one test. So you need to check consecutively to accurately dictate the surge. If everything in your body as a woman is good, when you ovulate, you can get pregnant. So if you test over the 5 days, you can have an opportunity of having 80% chance of predicting correctly your ovulation. If you check over 10 days, the accuracy level will rise up to 95%. Now, we also have computerized fertility monitor, which can help you to predict with precision. The only drawback is the fact that it's expensive, but it works. So the accuracy of the next generation device, it's so important to help you to predict when you are ovulating. Now, the fourth method, saliva fanning test. So this is just a way of using the saliva to detect if you are ovulating. Compared to ovulation predicting kit, this is less expensive. So this test works by checking the crystals that form in your saliva during ovulation. So during your fertile period in your cycle, there will be chemical changes in the saliva. So when the saliva dries, we can check under the microscope for what we call fan-like crystals. So the test kit will come in with a lens, which we can use to check the saliva. Around 5 minutes, when you view under the microscope, you will see the characteristic crystals which has developed. When this is consistent with ovulation, it's likely that ovulation will occur within 24 to 72 hours of first formulation of the crystals. So now the other method, it's also what so many women are depending on, tracking your cervical mucus. Now, for some reason, in women, when they are ovulating, there are changes in the fluid that got produced from the cervix. Charting your cervical mucus is not for everybody. It can give you misleading ideas. So it's certainly not gonna work for people that have irregular period. Now, some women can have increase in their cervical egg white mucus and they are ovulating. Some women might not have it, but they are ovulating. So what's the key word? Whether you have increase in your cervical egg white mucus or not, keep on meeting with your partner. So we are not the group that say, oh, go and make love within your ovulation or fertility window. It can work if you're younger and if you have regular predictive cycle. But generally, across the board, we encourage our women to make love around the corner. So around the time you are ovulating, that's about the ideal time to make love and conceive. Your cervical mucus will begin to be thin and clear. Its appearance will be exactly like raw white egg. This is in contrast to the usual creamy, sticky consistency. So if you are not ovulating, when you stick your finger through the vagina and into the cervix, you will notice it's creamy and sticky. But when you are ovulating, it will take the consistency of raw egg white. The thinning allows the sperm to pass through. So your cervical mucus is a very good nutrient that allows the sperm to come in, get to the womb, begin to go to the tubes. So when you are making love within the time of your ovulation, your cervix is going to be user-friendly. The fluid is going to allow the sperm to come in so that it can go into the alkaline environment and make sure it survives. This is why your cervix is very, very important. Anything that affects the integrity of your cervix can affect your ability to become pregnant. So you must make it a point of duty to be careful. So some women can have what we call cervical stenosis. When you have cervical stenosis, what happens? This cervix is going to be gummed together. When the cervix is gummed together, the sperm cannot come in. When the sperm cannot come in, then possibility of becoming pregnant will not happen. Now, you also need to be careful. When you go for your D&C, your evacuation and illegal abortion, they can damage your cervix. They can damage your womb. When this happens, you can develop adhesions, and this can affect your ability to become pregnant. So it's very important the integrity of your cervix is maintained. Now, what's the borderline? Have sex regularly, every 48 hours. So tracking your ovulation isn't necessary if you are sexually active, especially if you're younger. It's better to increase your sexual regularity and frequency to at least every 2 to 3 days. But in our group, we preach 48 hourly. So while ovulation monitoring can certainly be helpful in helping couples to overcome their challenges of infertility or even to avoid getting pregnant, making love around the corner any which way on regular basis will offer you better chance of becoming pregnant. Now, what's the final word? It should come as no surprise that if you are pregnant or if you are planning to be pregnant and everything is okay with you as a woman and your partner is also okay, when you observe the methods I've mentioned, you are easily going to get pregnant. But the key word is what? Underlying reproductive issues. So if your tubes are blocked, if you have hormonal imbalance, if you have adhesions, you can still ovulate, but you can't become pregnant. So the key word is your reproductive issue. So we need to find out what the problem is in the first place. This is where we need to be careful. However, if you are using any of the methods I mentioned to prevent pregnancy, be careful to talk to your doctor to make sure that the method you're using is effective. Your doctor can answer your questions and give you the best approach that can work for you. Okay, so that's the presentation very quickly on ovulation. Very simple, straightforward, different methods of predicting if you are ovulating. So if the calendar method works for you, you're younger, you know you regularly bleed, then apply it. So every woman should know their cycle. When you know your cycle, you can estimate your ovulation. So calendar method can work, saliva method can work, basal body temperature measuring can work, using your cervical egg white mucus can work, ovulation test kit can work. Now, my people, the reason why I'm teaching this is not to tell you to go and be obsessive with doing this. Whether you know you are ovulating or not, from your own standard, the only confirmatory test for ovulation is to go into a gynecologist office. We collect your blood sample, we check a couple of hormones. But these are the things you can use by yourself to improve your chances. So please, don't go dwelling on just checking. When you are checking, so long as you're not bleeding, keep on making love. You will have a better chance of becoming pregnant when you increase the frequency of your lovemaking. By yourself, every singular woman made by God, until you go into menopause, you can become pregnant. The reason why God gave you calculated number of eggs, 400 approximately, is to make sure you make good use of the time you are given. This is where age can come in. If you are younger than 35, you have more eggs. If you are older than 35, you have fewer eggs. Out of that fewer eggs, the quality of them is also depreciating. So time is of essence if you want to be a mother in this group, you must make good use of your time. Once you clock 35, you are advanced. You're going to have challenge, but you will overcome challenge. How can you overcome challenge? By using the right knowledge, by applying the right method, by changing your attitude, by changing your practices, by changing your perception. If you can do this, you will be a mother in 2022. So don't lean on your understanding. Don't lean on things you have been doing before. So while you are learning about your ovulation, also make love. While you are also making love, also see a fertility specialist. While you are also seeing a fertility specialist, pray to God. Of all the methods we teach in this group, if you notice, my pray, play, practice can be applicable in any aspect of your life. Above all, God is the ultimate decider of who is going to be pregnant. Then you need to place yourself in a better place so God can increase your possibility of becoming a mother. If you don't do this, you might likely be delaying yourself. So this is where you need to make up your mind, take a decision, stand on it, begin to follow it until you become a mother. Don't give up. Okay, so thank you so much. I'm going to open the clinic now so I can take care of your questions. So the clinic is open. You feel free to ask your questions. I'll put it on the screen, then I'll provide you feedbacks. Make sure you follow the admin. Register for the symposium. We're going to talk about IVF. We're going to talk about IUI. We're going to talk about surrogacy. We're going to talk about donor eggs, donor sperm, and adoption, and even fertility management. Okay? Remember to pray always. Remember to play 48 hourly. That means love making 48 hourly. Then please practice. Every single thing I'm teaching you today, put it into practice. When you do this, you're going to get there. But guys, it's time for questions. So if you're in YouTube, feel free to use the comment section. Ask me questions. If you're my friend in Facebook, ask me questions on my page, on my timeline. If you're in our group page, ask your questions. If you're in our group, ask your questions. So if you're in any of the 4 platforms, this is an opportunity to ask your questions on my teaching. Then I'm going to give you feedbacks. So please go ahead and ask your questions. Admin, if they've asked questions already, please put it on the screen. Remember to subscribe. If you need to consult with me, you can come in for 1 week. You can come in for 1 month. You can come in for 3 months. You can come in for 6 months. If you are already pregnant, please join our SGHS ANC clinic. If you want to be a mother in 2022, please join our Believing for Baby lounge in Telegram. Now, please, when you get to our ANC lounge in Telegram, make sure you use the 2 windows. You have access to me 24 hours. But the duty is for you to ask your questions so I can attend to you. Don't just go there and stay there and you're not using it. It's more like you're in water and you're thirsty. If you have access to me, please milk my knowledge. I'm practically begging you. I want to give you my knowledge. I want to help you to become. But if you don't tell me about your problems, if you don't ask your questions and you assume, I won't help you better. So if you're in any of our lounges, Believing for Baby lounge and ANC lounge, make good use of your 2 windows, okay? But right now, guys, let's take care of your questions. Please ask your questions. If you have any questions, if you have any things you need to clarify about my teaching on ovulation, please ask. And I'm going to make my slide available. So after this, I'm going to share my presentation. Some people learn differently. So but right now, please ask your questions, okay? So let me go up and see if I can find any questions. So guys, it's time to ask your questions. If you need to subscribe, follow the admin. Remember, today we were talking about ovulation, and I was using the beautiful female reproductive system. This is the citadel of creating our kids. This is where everything happens. The strongest organ in the body is the womb. So this is your womb. You can see it's a pretty beautiful structure. Now, when you get down to here, you see the cervix. So this is the cervix. So the cervix is the junction between the womb and the vagina. This is the vagina. So when your partner pulls the penis, when your partner ejaculates, that means when your partner releases, or what you guys call cum, it's gonna ejaculate, it's gonna release the semen. The semen is what you see with your eyes. But inside the semen is The sperm, they are invisible to the eyes. The sperm will be what will get you pregnant. The sperm will pass through the cervix, get to the womb, then it will choose either to go to the left or go to the right tubes. When it gets to the tube, it will go to a special place called the ampulla. By then, it's expected that ovulation has happened. So this is the cross-section of the ovaries. When you release your egg, it's going to enter through this side of the tube. If you notice, this side of the tube has some finger-like projections. It's called the fimbriae. The essence of a finger-like projection is to draw the egg that will be released into the tube. There's a special place called the ampulla. That's where fertilization will occur. Now, when the sperm comes in and the egg comes and the fertilization occurs, after the fertilization, they must come back and implant in the womb. When this fails to happen, when pregnancy begins to develop on the tube, that's called ectopic pregnancy, and it's not a viable pregnancy. We have to stop that pregnancy and make sure we save the life of the woman. Unfortunately, we can't save the life of the baby. When you have a ectopic pregnancy, we have to stop that pregnancy, and in some situations, most times we have to cut off that tube. Okay, let's see what we have. Hello, doc. How long does it take to conceive after myomectomy procedure? There is no time frame right there. Now, what you need to do, if your fibroid was significantly troublesome. So what do I mean by significantly troublesome? It's bigger than 6 cm. It's likely located inside your womb. So there are two types you need to be conversant with and more concerned with. Intramural and submucosal fibroids. They are located inside your womb. Okay? So you can see this tiny space. This is where your baby should be developing. So anytime that occupies space where your baby will be developing can affect your ability to become pregnant. Now, in some women, even when they become pregnant, depending on the size of the fibroid, they can have miscarriage. Now, you've taken the bold step of removing the fibroid. So myomectomy is the surgical removal of fibroid. Okay? Now, what you need to do is to recover. So you need to go back for post-op, post-surgical follow-up. We will check your womb. We'll make sure it's healing properly. We'll make sure you're ready in your body, mind, and spirit. When you're done with this and we give you a clean bill to continue, then you need to continue making love. Your ability to become pregnant is not just dependent on the removed fibroid. Your ability to become pregnant is dependent on the fact that you're still ovulating, your hormones are okay, you don't have adhesions, your partner's semen and sperm. So your partner must have good sperm for you to become pregnant. So then you've done your own part. So there is no fixed time for you to become pregnant. But you've done the right things by removing the fibroid. Now you've increased your possibility and your chance of becoming pregnant. So keep on practicing PPP and you're going to become by 2022, okay? Very good question. Guys, keep asking your questions, please. Please keep asking your questions. I'm going to keep providing you feedbacks and then we keep going. If you have any questions, please ask in the next few minutes. Okay, let's see. Is there any possibility for one who has lost 2 pregnancies to have her tubes blocked simply because she is finding it difficult to conceive? My sister, very simple. How do you know your tubes are open? You go for HSG, hysterosalpingogram. You see, my people, if you want to become pregnant, there is no room for guesswork. What you are doing, my sister, is guesswork. Guesswork can delay you. Guesswork can give you a lot of distractions. So simply go and run your HSG. We need to check and make sure that at least you have 1 open tube. Now, if you've had 2 pregnancy losses, 2 things. If you lost your pregnancy before 20 weeks, it's called miscarriage. If you lost your pregnancy after 20 weeks, it's called stillbirth. Now, the question is, what caused that? Now, the fact you were able to become pregnant means if you were able to become pregnant naturally, it means that at least one of your tubes was working. Now, any woman can develop tubal blockage at any time. Unfortunately, when your 2 tubes are severely blocked, the only way for you to succeed in becoming pregnant is to go for IVF. So if you're following me this afternoon, if you were told after going for your HSG and they told you bilateral tubal blockage, it means, unfortunately, that both tubes are blocked. Now, my sister, listen to me carefully. Don't spend 1 kobo going to a place they will try to open it. I'm talking about a confirmed severely blocked tube. Save that money. Begin to go and seek help from a fertility specialist who will give you IVF. When your 2 tubes are blocked, you need to become pregnant only through IVF. Now, if one tube is blocked and the other tube is open, you can still become pregnant without one open tube, including having twins, including having triplets, including having quadruplets, if that's what God proposed for you. But please, if both of them are blocked, don't waste time. You can cry that day, you can feel bad, you can complain. Once you recover, begin to go and look for money for IVF. This is what we are going to teach on the 25th. Now, let me tell you exactly what you need to know. Your tubes are tantamount to like the bridge. So assuming you're going to Onitsha and you get to Asaba, you need to cross the Niger Bridge. That your Niger Bridge is your tube. Onitsha is your baby. Now, if you get to Asaba and the bridge is blocked, are you supposed to be at that bridge and be trying to use mechanical hands to push the bridge open? No. What do? You fly into Onitsha. You can either enter through Owerri or Enugu, then you still get to Onitsha. Or you use Ubo canoe to get to the other side. But for any reason, whichever way you need to get to Onitsha, this is what happens when your tubes are blocked. So my sister, if they told you your tubes are blocked and you're 35 and above, you don't have the liberty of wasting time. Oh. Go and save for money. Go and shop for money and plan for IVF, okay? All right. Doc, can you ovulate after giving birth without period? Yes. Newly delivered mothers can easily ovulate without bleeding. This is the origin of a woman nursing a 3-month-old baby or 4-month-old baby telling us, oh, doc, I don't know what happened. My partner made love to me. I'm pregnant. I was waiting for my period to come out. Don't wait for your period to come out. Oh. Especially if you're not doing exclusive breastfeeding, you can ovulate. So you can ovulate before you bleed. Your bleeding is dependent on a lot of changes in your body after birth. Now, the general rule of thumb, please allow 18 months to pass before thinking of becoming pregnant or having a baby. Your womb takes a lot of beating. Your body takes a lot of loss when you deliver a baby. When you quickly go back and forth to become pregnant, you are limiting your life expectancy. You are putting a lot of pressure on the womb. You are not being fair to the new baby. You're not being fair to the upcoming baby. So please, all pregnancies must be fully planned. So if after your childbirth, the first thing we have to discuss with you in a good hospital is contraceptive, because you can become pregnant before you bleed. Some women might not even bleed until after 1 year. But the fact you're not bleeding doesn't mean you're not ovulating. You can easily ovulate within 3 months and you can easily become pregnant. So imagine becoming pregnant when you haven't even fully taken care of your newborn baby and you are not sleeping in the night and your husband probably is not supporting you. That's a big punishment. So please don't do that to yourself. So yes, you can ovulate even before you bleed. Okay, so let's continue, guys. Keep asking your question. Okay, let's see. Okay, I've already answered this. How can you subscribe if you're in UK? Follow the admin, decide what you want, and we will be there for you. Okay, so guys, keep asking your questions. I'm gonna keep providing you feedbacks. Okay, someone is asking, isn't same link when subscribing in Nigeria? It's the same thing. If you're having problems subscribing in your location, you can tell your people in Nigeria to help you pay directly. But regardless of where you live, you can get help. So location shouldn't be a reason why you're not getting the help you need. If you can't pay in UK, in America, in Canada, in Australia, talk to your people back home or do whatever you need to do to get help. Okay? Of course, it's optional. Okay, guys, let's continue. Keep asking your questions, please. Okay, someone is asking, how do you use ovulation test kit? Very, very simple. Just like you use your pregnancy test strip. Go to a very good pharmaceutical shop. Make sure it's not expired, okay? Read the instructions. Very, very simple. There are different types out there. It's just like your pregnancy test strip. You bring out the strip, you pee on it, you check the color, and you determine. Very, very simple. Okay, so go to the pharmacy and they will explain it to you. Okay, guys, let's continue, guys. Let's continue. Keep asking your questions. Now, I want to thank Elizabeth Omori Giver in YouTube. Thank you so much. We need our population in YouTube to participate. So Elizabeth, thank you for participating from YouTube. Okay. Is it bad to go for HSG to check for your tubes for the 4th time? Now, you don't determine the test you need. The fertility specialist will determine. So you don't go spending the money you don't have, checking for things you don't need. So go to your fertility specialist. We are going to review. If you notice, if you sign up under me, I ask a lot of questions. I ask you to send me your report. There are standard tests you have to run for you and your partner. When I have all of them, I'm going to review. Then I'm going to tell you what you need to do. But please stop taking yourself and going to do this and do that by yourself. It's complete waste of time. You don't necessarily need to go and do HSG 4 times. We need to check the interval. There needs to be an indication. If the first one wasn't too clear, or if we notice you have partial, blockage, then we can tell you to go for the fourth one, for the second opinion. But stop wasting the resources you don't have. So stop wasting your money. You don't need to go all over the place, okay? Guys, keep asking your questions. Let me see. Keep asking your questions, okay? Let's see. 24-day cycle, when is the ovulation? Admin, please share the method we use in calculating ovulation. So what you need to know is to make sure you have a regular predictive cycle. Now, remember, I told you the regular one is 21 days cycle to 35 days. So in your case, it's 24 days, okay? Very simple. We are gonna use a tentative day 14. We are gonna apply 14-day method. So we are gonna minus 14 days from your 24. What are we gonna get? 10. So the likely day you're gonna ovulate is on day 10. Remember, it's likely, it's not mathematics. So the key word in applying all the methods I mentioned, it's your age, it's the regularity and the predictability of your cycle. If you have irregular cycle, it's not gonna work. And your irregular cycle will be more pronounced the higher you get in age. So you have a tendency of having irregular cycle when you're older than 35. But if you're younger than 35 and you know that every 28 days you bleed, then your cycle is 28 days. Then your ovulation is day 14. The more regular your cycle is, the more you're likely going to apply the method I'm using. Some women can have 26-day cycle. Some women can have 30-day cycle. Some women can have 35. So long as it's your regular, please apply the factor 14 and you will arrive at a likely time. Okay. How many months can you wait before you conceive again? 18 months. Very simple. 18 months. Okay? Is it possible to get pregnant 2 days after ovulation? Yes. You can get pregnant anytime in your cycle. Anytime, including when you make love during your bleeding. The reason why you can get pregnant when you make love during your bleeding is not because you ovulated during bleeding. It's because you have a short cycle. So remember that the sperm can survive up to 5 days. So if your partner makes love to you, you have a 5-day cycle, and your partner makes love to you 2 days to the end of your bleeding. You can easily ovulate. And remember that sperm that is deposited in the vagina can get you pregnant up to 5 days. So some women can become pregnant when they make love one time in their bleeding. And yes, some people prefer to make love during their bleeding. It's okay. There's no problem with that. So long as both of you are hygienic, that's okay. In love making, in sex, there is no boundary. Whatever works for you guys, do it. If you want to be jumping up and down like monkeys, that's okay. So long as there is contact and the vagina, that's all we need. If you want to hang your waist up and the man is dancing a willow, that's okay. Just go and do it. Okay, let's continue, guys. Let's continue. Keep asking your questions, please. Admin, please piggyback from the beginning and repost all the questions I haven't provided feedback on. I want to make sure that everybody in attendance today is properly attended to. So every singular question, I'm going to provide feedbacks. Okay, this is how we roll. I want to make sure I provide you with all the knowledge you need. Now, the decision of you coming forward to do the right thing is up to you. I can only do my own part. My part is to teach you. My part is to help you to make the right choice because you are a mother. So if you begin to delay, well, that's your own business. Okay, guys, let's see what we have. Let's quickly knock this off. Okay, I've already answered that. Okay, let me go up. Then I'm going to come down. Okay. Okay, is it possible to ovulate during menses? I've just provided a feedback on that. It's not possible. But when you make love during your bleeding, you can become pregnant because you can shortly ovulate. So if you have a short cycle, you can easily ovulate just shortly after your bleeding. but the possibility of ovulating during menses is almost 99% impossible. How do you subscribe? Follow the admin. Okay. Please, how can one know if she has adhesions? You go to your gynecologist. There are specific investigations. There are specific tests we can use to know if you have adhesions. Now, adhesions can come in if you previously went for abortion, and in course of during the D&C, they excessively irritate part of the womb. Then when it's healing, it will heal with scar tissues. Scar tissues is also called adhesions. When you have scar tissues covering the cervix and the womb, the cover, which is the endometrium, which should be smooth, is not smooth. When your endometrium is not thick enough, when your endometrium is not user-friendly, you cannot become pregnant. Implantation is not going to happen there. Now, thankfully, if you have adhesions, you can go for what we call adheolysis. So there are some minor investigations, there are some minor procedures we can use to correct that adhesions. So you need to seek help. The earlier you seek help, the better. What I've noticed in our group, so many of us want to just use questions to get solutions. The feedbacks I'm giving you is to help you to make sure you follow through. Like in your own case, my sister, if they told you you have adhesions, are you going to go to church today and be praying for God to come in and remove the adhesions? No, it's not going to happen. What are you supposed to do? You go to a gynecologist, they remove the adhesions, then you continue to make love to your partner. This is how to be practical. Manna do no longer fall from heaven. Unfortunately, so many women would have become pregnant today if they practice simple PPP. So many of you don't even have infertility. The problem you have is that you're not making love enough. The problem is that you're so depressed, you're so anxious, your libido is low, you no longer believe in yourself, you've lost hope. That's the problem you're having. But the moment you begin to activate your faith and you still go, it's not every day you love your love making. It's not every day. There are some days you will feel like bitter leaf, but you still need to make love. Some of you are quarreling today. You are sleeping in guest room. Oga is sleeping in the main room. That day you guys are quarreling might be the day you have a baby. Admin, capture all this for me. Making babies is a proactive process. So both of you must be serious. If your partner is not serious, he's the one delaying. So there is no shortcut. There is no, fast way of getting this done than doing it. So if you're not making love, you go back to the neck of the woods and you keep on making love, okay? You're going to become. The more you make love, the more you're going to increase your chance of becoming. Okay, guys? Keep asking your questions. So let me quickly go up, and check for questions. Then I'm going to come down. Admin has furnished you guys with everything you need regarding subscription. So as simple as 1 week can change your life. 1 week can grant you access to me for 2,000 Naira. 1 month with 5,000 Naira can grant you access to me. So for the 1 week and the 1 month, we can correspond with chat conversation. We chat, we keep cracking, then I will refer you. Now, if you step up to 3 months, classic, or 6 months, prime, we can talk. We can schedule a talk. I can talk to you. I can talk to your partner. Then we begin to find solutions until you become pregnant. Not just becoming pregnant. Until you have your baby, you won't stop seeing me. I'm going to be showing up every single day until all the women who God made mothers will become. Until the very last mother became a mother in this group, you will keep seeing me. So don't expect to stop seeing me. This is my mission, okay? Guys, let's continue. Let me provide you feedback so you can go and have a very good weekend, okay? Okay, so I'm going to go down and see what we have. Okay, Dr. Ndiche just came in. Okay, and thank you for providing feedbacks. All right, guys. Okay, keep asking your questions. Admin, please, can you piggyback and repost all questions I missed? I want to make sure, okay, here we go. Okay. Is there any possibility for one who has lost 2 pregnancies to have our tubes simply blocked? I've already explained this. Your tubes can easily get blocked anytime. But the possibility of your tubes getting blocked is dependent on your history. So if you have untreated chlamydia, gonorrhea, and they went to your tubes and formed a complex we call PID, they can damage your tubes. Okay, so you've lost 2 pregnancies. The question is why and when. Like I explained, if your pregnancy loss was before 20 weeks, it's called miscarriage. If it's after 20 weeks, it's called stillbirth. So the question is why. Now, you asked, is it possible for one who lost 2 pregnancies to have her tubes blocked simply because she's finding it difficult. So you need to step up, my sister. You need to step up from your asking questions to investigations. So you need to go to a fertility specialist. We need to run your HSG. So your HSG will tell us the state of the 2 tubes. So you might probably be guessing now, but we don't know. So it's possible that your tubes are open. It's possible the problem is coming from your partner. It's possible it's adhesion. It's possible it's, hormone imbalance. It's possible it's anything. But we can't guess. The only way for us to know is to go and do the right things. So I will personally advise you to subscribe so we can refer you, okay? There is no room for guesswork in our group. Okay? Is it possible what is the possible cause of painful period years after removing fibroid? So people are wired differently. There are some women that during their bleeding, they have a lot of pain. This is because of increase in a particular substance we call prostaglandin. So when your body is expelling all those contents, remember what leads to bleeding in a normal ovulatory cycle. So you see, when the eggs are released, when you release your eggs, it's expected that the eggs will get in here at the ampulla, then the sperm will come in. Now, if the eggs are released and it wasn't fertilized, the cover of your womb will always be preparing to receive the fertilized egg. Now, when fertilization doesn't occur, the egg is going to disintegrate within 24 hours. The cover of your womb will break down. The breaking down of the cover of your womb is what leads to your bleeding. This happens about 14 days after you've ovulated. Okay, so now in some women, when this bleeding is happening, they will, release a lot of prostaglandin and their body will start having pain in reactions to that. So your bleeding currently might be related to that. Now you've removed your fibroid. If this pain you are having is a new discovery, then we need to investigate further. It's possible you have other tiny fibroids that were not removed, regrowing. It's possible you have other conditions in the womb. So there are so many gynecological problems you can have, but we cannot just sit back and be making guesses. So if you are having substantial pain during your period and you've removed your fibroid, please piggyback. We need to investigate further. There are so many things that can cause pain in the body of a woman. So you need to piggyback and we investigate further, okay? Okay, someone is asking, what's the cause of secondary infertility? This is a broad spectrum question. So secondary infertility means in the past, you got pregnant. 3 things can happen to your pregnancy. You had your baby. You had inevitable loss of your pregnancy, either stillbirth or miscarriage, or you aborted your baby. So these are the 3 possibilities in your pregnancy. So if you were pregnant in the past, and for some reason you had your baby, you had miscarriage, you had stillbirth, or you aborted your baby, but currently you are wanting to become pregnant and you're not able to become pregnant, it's called secondary infertility. Now, this problem can be a male factor problem, it can be a female factor problem, it can be blockage of your tubes, it can be hormone imbalance, it can be adding body weight, it can be adhesions, it can be anything. So if you are having secondary infertility, you have to book an appointment, you have to go to a fertility specialist together with your partner. Having a baby is not only for women. We need the men. We need your sperm. So stop running away. You must submit your sperm. We need to analyze your sperm. The problem might be coming from you. So many of you are bullies. You bully women. You call them names. You tell them, oh, woman, go out here. I've had babies in the past. It's not true. You can have 20 babies last year, and this year your balls are not containing any sperm. So you must submit your balls for checks, okay? This is no joke. I don't come here to joke, okay? Let's continue. What could be the cause of serious waist pain? Pain is a subjective thing. So there are so many things that can cause pain. It can be infection, it can be muscular, it can be hormone imbalance, it can be fibroid, it can be gas, it can be a lot of things. So how do you know? If this pain persists, go and see a doctor so we can see what we can do about it. What about the link to make payment from your Nigerian account? Everything you need is provided, okay? All you need to do is to follow through and you will get help. Cause of pelvic pain after period. Like I said, I've already explained that. Anytime you have pain, we need to investigate, okay? Pain can be caused by a lot of things. Okay, admin already posted the formula for your ovulation. Please follow it religiously. It's gonna help you a lot. Okay? Gallbladder stone surgery. When can one start fertility treatment? When you've had surgery. Anytime you've had surgery, piggyback to the surgeon. The surgeon is the person that will tell you to continue or to stop. So go for your post-surgical follow-up. Anytime you've been operated on, it causes a lot of stress on your body and it can affect your fertility. So don't start making love until you're told to make love. In as much as your gallbladder is not connected to your fertility routes, it can affect your whole hormonal balance. You need to get a clean bill. You need to get a clean go ahead and continue from your surgeon. So go back to your surgeon, okay? Very, very important. Don't neglect this, please. The body of a woman is very tricky. When you don't treat your body properly, it's going to play tricks on you. Can fibroid of 6 cm long prevent a woman from becoming pregnant? Yes, especially if it's inside your womb. So you need to go and consider removing it. So the answer is what? Yes, it can. Okay, let's continue, guys. Let's go, guys. I have 3 more minutes. Okay. What's the relationship between COVID vaccine and infertility? As of today, there is no known study that says, oh, if you take COVID vaccine or if this happens, you're not going to get pregnant. We haven't had that study. So until proven otherwise, go and have your COVID vaccine. You are better off having your COVID vaccine and staying around to even have a chance to have your baby. You don't want to pick up this COVID. It's really, really deadly. So there is no connection between COVID as of now and your fertility. This is what I know as of today. So there is no study that says, oh, if you're planning to become pregnant, don't go and take your vaccine. We haven't found that study. What we preach in this group is evidence-based. So until proven otherwise, go and take your COVID vaccine. I've had my own. My wife had her own. Our kids are not up to date to have their own. I've encouraged everybody I know to go and have their vaccines. Please go and have your vaccines, okay? Okay, let's see. Can ovulation be irregular? Yes. So if you have irregular period, if you have irregular cycle, you might also be having irregular ovulation. So you can ovulate in January, then your next ovulation can be May, then your next ovulation can be September. When that happens, you need to expedite. That can happen with age. So we need to first of all confirm you're not having ovulatory problems. Okay? So let's continue, guys. Let's see. Let's go. Can little bleeding lead to fetal not growing as supposed? Can it finally lead to fetal death? Yes. Anytime you're pregnant, anytime we notice bleeding or water coming out of your body or you're having backache, it's possible is a precursor to losing that baby. So yes, bleeding in pregnancy can be a sign that your baby is about to be miscarried or you have stillbirth. So yes, it can happen. Okay, unfortunately. Okay, let's see. Why do some women have pains during lovemaking? Couple of things. It's possible you don't know how to make love. It's possible you were not ready. It's possible you have infection. It's possible it's because of age. So when you're getting older, when you get to 35, your estrogen begins to fall. When your estrogen is falling and your FSH is going up, you are prone to be having dry vagina. If you are not in the mood, if your partner is forcing you to make love, then you're going to have pain. If you have infection, then you're going to have pain. If you have hormone imbalance, then you're going to have pain. If you have psychological problem, then you're going to have pain. Some women were abused in the past. Some women have what we call vaginismus. So the muscles of your vagina is so contracted that you begin to feel pain. Naturally, making love is the sweetest thing in the world. It's like sugar. So if your own love making is not like sugar, you need to go and check it up. But by default, as you are getting older, you are going to be having dry vagina. And the drier your vagina, the more likelihood you're going to bleed and even have pain. But the way the body of a woman is constructed during love making, so long as you and your partner want each other, there is a particular gland in your body that will open. So like what waterfall, when it opens, so no matter the size of the penis, once you are ready, once you are wet, once you are in the mood, your partner can have the longest penis in the world, you will contain it. Imagine the size of your baby that comes out from this vagina. So your vagina is structured to contain any size of the penis. But the problem is lack of love-making skills. So if you don't know how to make love, we can help you. Admin, share the PDF for love-making and we can help out. If you need to subscribe for Classic, remember Classic and Prime can give you access to talk to me. If you are in our light, which is 1 week or 1 month, basic, you don't have the talking opportunity. I always want to make it clear. So if you need to talk to me, you step up. When you step up, we can talk and you can get help. Now, if you're in Abuja, Asaba, Awka, Benue, Calabar, Enugu, Jos, Kanu, Kogi, Lagos, Nnewi, Osun, Owerri, and Port Harcourt, we can refer you. we can refer you to the best out there, then you can go and begin to get help. Unfortunately, some people are not able to become pregnant today because they are going to people that can't help them. Stop going to that your family doctor that keep giving you clomid. He's not a fertility specialist. Stop going to that cottage hospital. Stop going to that dibia in your community. They keep putting nonsense hand into your body. They are not going to help you. You need to go to the right doctor. There are some doctors that are trained to treat anything infertility. They are called fertility specialists. So if you don't have any, we can help you. Okay? You always have pain around your knees anytime your period is approaching. This can be what we call PMS, premenstrual syndrome. So it's pretty much how your body is handling this. So pop your painkillers and you're good to go. Okay? Don't worry about it. All right. You want classic, please follow the admin. I'm just going up to make sure I provide feedbacks. My time is actually up, but I'm going up to make sure everybody's attended to before I go. Okay? It's weekend. So I normally have enough time during the weekend. So I want to make sure that everybody is good. Admin, please check and make sure I attended to everybody's question. It's very important. Okay, I've already provided feedbacks to that. Okay, provided feedbacks to that. Okay, if your questions have not been answered, please put it on the screen so I can provide you feedbacks before I go. Okay, but like I told you, I'm back with my teaching model. The only time I might not likely use it to teach is probably when I'm out there during work. But I will see how I can squeeze it in during work, during my work, my break time, so I can teach with you guys. I can teach with it for you guys. It's better you understand things, because the better you understand things, the earlier you can take the steps you need. I don't want anybody showing up in 2022 complaining that they are not mothers. It will break my heart. But please do your own part so I can do my own part so you can become. Stop wasting the time you don't have. You can at least go and hustle for 2,000 naira. 2,000 naira can make a lot of difference in your ability to become a mother in 2022. Don't sit on the fence. Okay? Don't sit on the fence. Do something. Okay. Guys, I'm just checking for questions. If your questions are not answered, you can ask again. Let me go down before I go. Okay, I don't have any questions. So admin, if you check and we are good to go, give me a signal so I can go. So admin, please do a quick check. Piggyback, go way up. Make sure that everybody's question is attended to before I go. Once you check and all the questions have been answered, you can give me a signal, then I can go. Someone is asking where in Lagos. Now you understand I'm in America, right? So I do things the way people do things all over the world. So before I can refer you, I need to know who you are. So I can tell my doctor in Nigeria, hey, Mrs. Okeke is coming. Mrs. Okeke is my client. Or treat my client well. Give them their medical report. Please treat them the way I want them to be treated. Now, when you go to my doctor in Lagos, we are going to correspond. We talk over the phone. We correspond. If we are having problems, we solve it together. This is how we roll in this group. We need to have a personal relationship with you. So I can say, if I'm referring you, I can say, oh, Mrs. Okeke is 41. She's been having problems with having a baby. She had 5 kids. She had 5 boys. She want to have another girl now. Then I can tell my provider in Lagos, and my provider can figure out what they will do for you. So we don't just give referral to everybody. We give referral to only subscribers. So this is one of the advantages of subscribing, okay? But if you don't have the money, it's okay. You can still show up every day. If you can apply everything I've been teaching you guys in this group, you're going to get pregnant. Please recommend lubricant that is sperm friendly. Pre-6. Admin, please type in for them. Pre-6 or baby dance. Pre-6 or baby dance. This is where you need to be careful. Now, ordinarily, my sister, if you are not tending towards your menopause, you don't need any lubricant. Your vagina is ready to power lovemaking. But the problem is we worry a lot. We think about things we're not supposed to be thinking. Some women will be lying down in their lovemaking arena. They are thinking about the ofe they haven't cooked. They are thinking about how to go and make money. They are thinking about gossip. When you're making love to your partner, so many women travel during lovemaking. They are just lying there. The only thing in their body, give me my baby girl, give me my baby boy. That's not the act of lovemaking. Lovemaking is not just for making babies. Lovemaking is also for, pleasure. But unfortunately, when you stay there and your body is travel, you're going to be in pain now. Your body is not going to release the fluid. But please, if you are having pain during sex, okay, you can use only sperm-friendly lubricants. The reason why you need to use only sperm-friendly lubricants, there are some fluid, there are some gel you put inside the vagina. It will stop the sperm from getting in. So some lubricants are not sperm-friendly. They are what we call spermicides. They kill your sperm. So go for Pre-6. You might not likely see it in pharmacies in Nigeria, but you can get it from Amazon or online. Get that one. It works like magic. Okay? Okay, someone is asking, what's the cause of low sexual urge in men? So many things. Lack of sexual interest can come from your partner recently added a lot of body weight. He's drinking a lot of alcohol. He's not sleeping. He's not exercising. His tummy is bigger than Michelin tummy. He's pretty much not doing the right things. If your partner previously used to make love to you morning, afternoon, night, then he's no longer interested. It's possible something is going on in his life. So he needs to tell himself the truth. He needs to comfort. He needs to start exercising. He needs to start sleeping. He needs to stop avoiding stress. Now tell your partner for both of you to subscribe and grab the PDF. Admin, share the PDF for lovemaking, for better sex relationship, and go and watch it, and you can get a lot of things from there. Okay, guys, I'm just trying to make sure I do justice to everybody's question before I go. My time is really up. Okay, hello doc, let's see. You're having difficulty to conceive, and you are also having pain at the back. Please help. Subscribe, my sister, so we can know what's going on. We can know the duration. We can know your age. We can check your own test. We can check your HSG hormone test, AMH, ovarian reserve test, check your partner's seminal fluid analysis, and we can find out why you're having this pain at the back. It can be fibroid. It can be a lot of things. So that's the help you need. So I want to help you, but I want you to help yourself too. Okay, guys, admin, give me a signal if we're good to go. Just tell me, Dr. Trudy, we are done. We no longer have any question. I want to make sure that all the questions are attended to. Okay, let me check care of this. What about KY lubricant? KY jelly is not recommended. KY jelly can kill the sperm. Now imagine your partner that has oligospermia. That means the sperm count is already struggling. Then you're not gonna go put something that will further make it bad. Don't put Vaseline, don't put water, don't put olive oil, don't put anything inside your vagina. It's gonna stop you from becoming pregnant. Go and look for Pre-6 or baby dance. If you have searched for Pre-6 and baby dance, go to the internet, go and order it. Stop looking for it. Look, my people, we give a lot of excuses. This is the simplest thing you can do for yourself. Go and find it. It doesn't matter where you can find it. Just go and order it. Okay? Some of you go and buy the most expensive shoes anywhere in the world. Then we give up easily. Stop giving up. Okay? Go and do it. My people, you need to be radical. We must be radical to defeat infertility. What does Dove? Okay, I've already provided this feedback yesterday. This Dovestone, it's a type of progesterone. Okay, it's a type of progesterone. We use it to support pregnancy. So progesterone is a pregnancy maintaining hormone. When your progesterone level is not adequate enough, the likelihood that the cover of your womb, which is called endometrium, might not be thick enough. So when the thickness of the endometrium is not strong enough, you're going to miscarry. So this is why we give women that previously had miscarriage, or if we notice that I actually shared an article on progesterone this morning, early this morning. I authored that article, I shared it. When your progesterone level is low, the likelihood you might not even become pregnant in the first place is high. Or the likelihood that when you become pregnant, you're going to have miscarriage is very high. So we must correct that. So that's why we give you that particular hormone drug when you're pregnant. Okay. Okay, guys. All right, guys. Can cough, catarrh, hotness of the body affect 13-day embryo transfer a problem? It's not directly a problem, but we need to know why you're having cough, catarrh, and hotness of your body. It's possible you have an infection. And if you have an infection, infection can have a pan-systemic effect on your growing baby. So you must report back to the doctor that administered this IVF. Anytime you notice anything when you're going for IVF, please piggyback to your doctor. So the hotness you're having in your body is fever. So we want to know why you're having fever. You're having catarrh. We want to know why you're having catarrh. You're coughing. We want to know why you're having coughing. So it's possible you have respiratory infections, and we need to take care of it. So you must go back to your doctor. Very, very important. These are the things you can gain when you come for our classes. Unfortunately, let me tell you what happened. Some of us are so smart that we outsmart each other. You pay 2 point something million to go for IVF. You don't know anything about IVF. You're just waiting for the result. When he fails, they tell you, oh, madam, he failed. Sorry, God did this, God did that. Nobody's giving you reports. But when you attend the class, when you know everything about IVF, you can ask meaningful questions when you go for the consultation. You can demand your reports. These are the things you gain. But some of us, the last thing we'll do is to subscribe to anything in this group because we believe I'm coming to take you guys' money. Really? Can viable eggs be removed from 50-year-old? The possibility you will have quality eggs at age 50, it's very, very tough. But it's not impossible. You might still have eggs at 50. But here's the deal, my sister. Once you get to 40 and you're planning to go for IVF or any ART, the best option for you is to use donor eggs. So at 50, can you become pregnant naturally? Yes. What are the chances? 1 in so many millions. But can it happen? Yes. Has it happened before? Yes. So what are you supposed to do? Keep on making love with your partner, but present yourself to a fertility specialist and go for donor eggs. Because you will blink, you enter menopause. Now, even in your 50, we first of all need to know if you have eggs to start with. The possibility you no longer have eggs at 50 is high. Because at 50 is when you start getting ready to enter menopause. Okay? Let's see. What causes? Okay, I've already provided feedback to this. So the daptoxone we are giving you during pregnancy is a progesterone that will help your pregnancy to survive. Okay? Missed period preceded by egg white discharge, test says negative. What could be the reason? My sister, you're not pregnant. So the fact you have all those egg white discharges, if you're not pregnant, you're not pregnant. If you've checked after 7 days, make sure 7 days have passed. If you check your urine pregnancy test strip after 7 days, if you're not pregnant, unfortunately, you're not pregnant. You can step up and go and do your blood test. If you're not pregnant, you can cry that day, you can jump up and down, you can feel bad. Once you pick yourself up, once you stop bleeding, keep on firing. So pregnancy is all or none. It's either you're pregnant or you're not pregnant. So some people, based on your mindset, you will say, oh, doc, I saw a partially positive and partially negative test. No, it's either you're pregnant or you're not pregnant. Okay? Is there any assurance with donor eggs will lead to positive pregnancy test? You have a better chance of having a good outcome when you use a younger egg compared to your egg if you're in your 40s. So the assurance is there. But guess what? Just like in life, you can't guarantee anything. But that's your best choice. You have to step up. Every woman looking for a baby must go for ovarian reserve test. Your ovarian reserve test will tell us if you still have eggs, what's the quality of the eggs you have. Once you have poor ovarian egg reserve, then you need to go and use your donor eggs. Because the possibility you will spend millions and you will fail and you lose your money and you lose your time is there. So don't play games. If you have to go for expensive procedure, make sure you're using the best. Most, if not all, donor eggs will be from 35 down. We use younger ladies' eggs because they have a better chance. The older you get, the more you're likely going to have abnormal eggs. The younger you are, the more you're likely going to have normal eggs. So the older the abnormal, the younger the normal. That's the way the body of a woman is structured. Okay, admin, are we good? So I put an extra jar for us. Okay? All right. Okay, guys, if you have any other new question I haven't attended to, you can ask. Admin has also shared the links for the Surrogacy IVF IUI Symposium. Register. It's going to be on the 25th by 9 p.m. Nigerian time. Okay? 4 p.m. US time, Eastern time. And we have a special guest who is an IVF specialist. He's going to come to teach us everything we need to know. Okay, we are good to go. Okay? Missed period for more than 20 days. What's the cause? You're not pregnant, you're not pregnant. Okay? Missed period might be a likelihood that you're preparing to go into menopause. Okay? So we need to know the duration. So if you haven't seen your period for 3 consecutive months, you have amenorrhea. We need to investigate, okay? Okay, we're good to go, okay? Daptoxone doesn't boost your egg quality. I've already explained this severally. It's a form of progesterone. Someone with donor eggs still have negative pregnancy tests. Unfortunately, it can happen. So you can go for donor eggs. Like I said, it's not guaranteed. then you have a better chance. Okay, guys, thank you so much for coming. I'm going to go this time. Please continue to ask important questions. Please continue to pray, continue to play, continue to practice. You can actually apply this in any aspect of your life. So you can pray about that business opportunity you're not getting. You can play. So that means you wake up every morning and you keep hustling. Then you can practice. That means all the things you need to do, you practice it. Even in your exams, you can pray to God. Then you can read your books. Then you can go to exams. So it's not only in becoming pregnant we apply PPP. PPP can be applied in any area of your life. So thank you for coming. I hope I've attended to everybody's question. Now the problem is not providing you feedbacks. The problem is, what do you do with the feedbacks I provide you? Are you going to step up? Are you going to subscribe? Are you going to attend the symposium? Are you going to go do your IVF? Are you going to go do your IUI? Are you going to go adopt? What are you going to do before you next year? What is that particular thing you are not doing? You haven't done it before. Are you still going to be taking your Clomid? Are you still going to be complaining up and down? You went to church today, they asked, oh, people that don't have babies, stand up, let's pray for you. They have been praying for you for 15 years. Do you think prayer is the problem? No. Some of you are blocking the only thing that will help you to become pregnant. You go to church, they tell you, oh, let's find and cast IVF. Oh, let's fire and brimstone is not my portion. It's not my portion. You are blocking the only way that God says is going to bless you. Stop praying the negative prayers, my people. Begin to call forth your baby. Begin to call their names. Begin to decorate their rooms. Begin to see them playing around the house. This is how to become pregnant in 2021 and become a mother in 2022. Stop spiritualizing things that doesn't have any spiritual undertone. If you have medical problem, go and seek help. The earlier you seek help, the better. If you are not careful, you might end your life without a baby. And this is not God's purpose for you. Don't blame God. In next 10 years, if you're not a mother, you've refused to make that decision. You can be a mother through the natural means of making love with your partner. You can be a mother through IUI. You can be a mother through IVF. You can be a mother through surrogacy. You can go for donor egg. You can go for donor sperm. You can adopt. They are all mothers. They are all fathers. They are all kids. There is no difference. I cannot stop emphasizing on this. Some of you are not mothers today because you have removed yourself from the equation, because you have refused to go for IVF. Meanwhile, IVF is your only option because you don't believe that adopted babies are babies. And the people that are giving you advice are deceiving you. They have their kids, my people. The same people discouraging you at your back, they are blaming you. The people that have babies are not better than you. They don't have two heads. They are not holier than you. The challenges you're having today, some people had the same challenges, but they stepped up. Few days ago, you celebrated the twins. I posted in my group. How did that lady have her twins? She went for surrogacy. Step up and do something extraordinary. Motherhood requires... Admin, capture this for me. Admin, please capture this for me, please, before I go. Motherhood requires extraordinary power. Your extraordinary power steps in where you say, you know what? I'm done with infertility. I'm sick and tired of being infertile. I'm sick and tired of being single. When you say this prayer, open doors will happen. Look, I'm telling you the truth. I've seen this happen. I've seen God do exceedingly and amazingly, wonderfully, miraculously. I've had a 45-year-old lady present to this group, and she said, you know what, Doc, I'm going to go anywhere you say I should go. I said, okay, you know what? Tell your partner we are going to go do IVF. And she said, no problem, I'm going to go do it. The partner was giving her trouble. I said, okay, set up an appointment. I spoke to the partner. They went for their first IVF. In Warri, they are mothers and fathers of twin boys. Then 2 days ago, you saw beautiful baby boy and baby girl. These are women that took both steps. So it won't pay you if you're listening to me this Sunday. Thank God it's a Sunday, and I'm challenging you. Don't allow my sweat be in vain. Don't allow my efforts be in vain. I've been showing up since 2015, every single day. And I've been shouting the same. I've been telling you you're a mother. I've been telling you you're a father. I've been telling you you don't have a problem. I've been reminding you we were made a mother. There is absolutely no problem with you. You have to go back and you have to play this video every single day. Prepare a good meal for your partner. Prepare a good meal for your husband. Sit down, deconstruct, listen to me, get the help. Begin to shout. So many women are fruitful. So many women would have become grandmothers, but their partners are the problem. So many women that can step out and have relationship can become twin mothers. Today, some of you might enter menopause by end of this year, but you will not understand this until you blink. And the only option you have is to go for donor egg. You better use your eggs now you have it, so that when the donor option comes in, you won't accept it. The possibility you're gonna use donor egg when you haven't even gone for IVF is limited. The problem is in our mind. You are not seeing yourself as a mother. You are seeing yourself as a failure. Motherhood requires extraordinary power. Believe me, even in the Bible days, when Sarah was praying, Sarah was filled with a lot of faith, and God made it possible even in her old age. So it doesn't matter how old you are as a woman, you can be a mother. Yes, you can quote me anytime. Age got nothing to do with it. But what you need to do in your age 80 is not what you need to do in your age 30. It's not what you need to do in your day 20, because you age. You're not going to be the same. You're not going to be like, man, we don't have time. Call a family meeting. And let me empower you, my people. Listen to me. You are someone else's daughter. You matter. Your happiness matter. When you guys were doing societal wedding, you're taking your vow for better, for worse. Now this is the worst. And he's running away. He's not following you to treatment. You're going up and down. The problem is not even you. One, a little hand that any other man out there touches you, you're going to become pregnant. The problem is coming from him. And he's experimenting outside. He's got girlfriends all over the place. Anytime he tells you he's going for business, he's trying to impregnate all those girls. Then you come in, some of you will present your emotional problems to me. Oh, Dr. Trudy, he doesn't do this. My sister, I can't take that decision for you. Believe me, I'm telling you the truth. You have to know when to walk away. If what you signed in contract in this marriage is not working, you can walk away. There are people that will help you out there. Believe me, like I'm telling you the truth. Because you cannot be fertile the rest of your life. You are timed. We don't have the same opportunity. God bless you guys, and please, let's get it right in the month of July. Remember, you have only one opportunity to become pregnant in July. Don't miss it. Don't practice ovulation sex. Don't practice fertility window sex. Don't think you know it all. Just wake up every day, pray, play, and practice. Every singular woman having problems having a baby, you need a fertility specialist. If the doctor you're seeing is not the right doctor, we can help you. You cannot complain you don't have the help you need in this group. Every single day I wake up, when I'm done with my prayers, as I'm getting ready, I'm thinking, what am I going to do with my people? Sometimes I construct articles when I have free time. I do stuff 24 hours. This is what I do. It's for you guys. It's my mission. I'm doing my own part. Ask yourself the simple question. Are you doing your own best? Have you done everything you're supposed to do? Are you dilly-dallying? Are you waiting for the money? What is even money? Money is paper. You don't stock millions and you're waiting for December to go back to the village to show the society that you have arrived. Meanwhile, you don't have kids. How silly can that be? You built a very big mansion. You drive big houses. You try and impress them. The people you're impressing at your back, they are calling you Barry. They are saying, look at him. He doesn't even have a child. They won't even allow you to talk in your village meeting. When you want to talk, they say, sit down. After all, do you have kids? They have called you names. Your sister-in-laws, your brothers-in-law, some of your husbands are even calling you names. Are you not tired of being called names? Come on now. You're someone else's daughter. Someone is your father. Someone is your mother. You have siblings. Let nobody bully you. No more. God bless you and enjoy the rest of your weekend. Remember, tomorrow, 5 p.m. Nigerian time, I will be there. Make sure you're there. Make sure you do everything you need to do. Register for the symposium on the 25th. Go to our YouTube, subscribe, share this video, save this video. This video can change families. This video today, for some reason, I've spent 1 hour, 24 minutes. 1 hour, 24 minutes. Think about it. This video might be the video that can wake your family up. This video can solve a lot of marital problems. And that's the reason why I keep it open. My people, I don't pretend. I'm a faithful Christian. I believe in God. But I believe that God helps those who help themselves. I believe that majority of our problems are spiritualized. The people in the village, my uncle, my auntie, my friend, they're not the problem. The problem is you. Begin to do the right things. Okay? God bless you. And your husband got another woman pregnant outside, but you could not get pregnant for him. That's the problem. So what are you going to do? That's even disrespectful. If I were a woman and my partner goes outside, that's the end of the story. Look, I'm keeping it real. I know if you run to your mom will tell you, yeah, be managing now. You know, your father did this to me. That was then. This is now. Know your boundaries. You are supposed to be loved and respected. You're nobody's slave. If your partner is messing with you, walk away. And unfortunately, most times, it's not even your partner you're contending with. You're contending with the sister-in-law. Some of them haven't even married. But they are coming to hijack your happiness. Challenge them. And some of you are not matured. Water will pour in the floor. You call your mother. You call your father. You begin to complain. You're not a baby. Marriage is not for kids. Having babies is not for babies. This is why we don't want babies to have babies. So the fact you are making love and you're becoming pregnant doesn't mean you're ready to be a mother. It's a responsibility. Let's change our ways, guys. I'm going to go for real this time, okay? So I love you guys. I'll see you guys tomorrow. God bless you and bye-bye for now.